Lung cancer is the leading cause of cancer deaths in the U.S., but screening and research have the potential to save thousands of lives.
November is Lung Cancer Awareness Month, and Dr. William Ehlenbach, a pulmonologist at SSM Health, joins us with some facts everyone should know about the diagnosis and treatment of lung cancer. Thanks for being with us today.
Yeah, very
Thank you.
important
Happy
topic.
to be here.
Now, let's start off with what are some of the risk factors that we should all know about?
Yes, the most important risk factor for lung cancer is cigarette smoking. And passive smoke exposure or secondhand smoke is also a risk factor. There are other risk factors. Radon, which is a colorless, odorless gas that can exist in our homes and concentrate in basements, is a risk factor for lung cancer. And there are, so occupational exposures or air pollution in particular can be a risk factor for lung cancer.
Is radon something we should all be testing for?
Yes, and you know, I think it's a good idea, particularly if you're purchasing a home in Wisconsin. Having testing done for radon levels in the basement is an important thing to do to ensure safety because it can be improved, it can be mitigated.
Okay.
So if you find elevated levels of radon, there are changes that can be made in ventilation that reduce the risk.
Sure.
If you do have lung cancer, what are the survival rates? What does that look like?
Yeah, one of the challenges with lung cancer is that there are few symptoms in most patients, so most patients are diagnosed at a relatively advanced stage. People who are diagnosed with lung cancer that's advanced or to spread to other parts of the body, median survival is less than 12 months. Overall, lung cancer survival averages about 5-year survival of 25%. Diagnosing lung cancer early can improve outcomes.
And tell us a bit about the screening process. Who should be getting screened? How early? How often?
Yeah, lung cancer screening is an intervention that can reduce lung cancer deaths. People who smoke and have smoked a pack a day for 20 years or more, or people who have quit smoking in the past 15 years, between the ages of 50 and 80, are eligible for lung cancer screening with an annual, once per year, low-dose CT scan of the chest.
If you are a smoker, if you've been a smoker for a while, does it really help you if you quit smoking? What does that look like?
Yeah, the risk of lung cancer does decline in the years after somebody quits smoking. So by year 15 of somebody who's quit, the lung cancer risk is half of what it was. And by year 25 or 30, the lung cancer risk goes down to that of a non-smoker.
So never too late to quit.
Never too late
and
to
get
quit.
yourself healthy.
Absolutely.
Are there certain symptoms and signs we should be looking out for if we think we might have something going
Yeah,
on?
one of the challenges, lung cancer symptoms are very non-specific, meaning they don't tell you that lung cancer is going on, but certainly a new cough, coughing up blood, wheezing in somebody who doesn't have chronic lung disease are some of the symptoms that can be an indicator of lung cancer.
I know you mentioned secondhand smoke being around that can lead to some lung cancer risks. What does that look like if you yourself aren't a smoker, but you might be around someone else who is?
Yeah, I mean, it's one of the reasons that I think everyone wants their loved ones to stop smoking.
Yeah.
They want them to stop for themselves, but they also don't want the risk of that secondhand exposure. And so even asking if there's a smoker in your life, asking them to smoke outside can mitigate that risk, reduce that risk.
I've actually had a family member diagnosed with lung cancer who didn't smoke but had other family members who did. So it's also about protecting the people around you. Is there a high prevalence of lung cancer in our community?
There is. I mean, lung cancer rates have actually declined a bit as smoking has declined, but it is the most common cause of lung cancer death in the U.S., as you mentioned.
Mm-hmm. And I think it's been really important. I was talking about this the other day, the changes in restaurants and public smoking, and so that so many of us are not around that secondhand smoke.
Yeah, that's really a kind of a public health success story, those changes that, that have been made in laws to reduce that.
We appreciate your time today. Very important topic.
Thank you.
Thank you for being here.